Hello my lovelies and welcome back to BrittneyOriel. Thank you for tuning in yet again to another one of my videos. Now this topic is a very serious and touchy topic that I have had mixed reviews when I told some people that I was doing this topic in my next video. However, I do believe that it was my responsibility that I took up when I came onto YouTube to talk about topics that no one wants to talk about but really need to talk about a lot more. So last week Friday, December the 1st was actually World AIDS Day. I did not know about World AIDS Day. I have never really heard about World AIDS Day. Now that I think about it, I did see people with red ribbons, but I didn't pay too much attention to it. While I was driving to somewhere that day, I heard some advertisements on the radio about AIDS and HIV, giving some statistics down in Trinidad of the amount of cases we have of HIV as well as AIDS in our country. And it basically was a light switch that went off in my head that this is going to be my next topic. So I scrapped my last topic. I'll probably do that in my next video, and I decided to tackle this because I wanted it to be as close to World AIDS Day as possible. What World AIDS Day is about? It's a day dedicated to raising awareness of the AIDS and HIV pandemic, as well as remembering any victims of HIV and AIDS that have passed away. I myself within my family did have a cousin that passed away because of AIDS. Very long story short, without giving not too much personal information out, her boyfriend did not tell her that he had HIV. She got it. A few years later, it developed into AIDS and she passed away. So I am very aware that AIDS and HIV is something to take seriously, and I do think we need to grow up and be mature adults and realize the seriousness of this lifelong virus and go out there, get tested, encourage our partners to get tested before we become sexually involved with them, and encourage our friends, our families, anyone that we know to learn more about HIV and AIDS, as well as knowing the HIV and AIDS status. I don't think anyone should be exempted from an HIV or AIDS test, whether you live a promiscuous life, whether you have never had sex, or whether you have been with one person for a long period of time. So what I hope to accomplish in this video is to give you as much information as possible so that you all are a lot more aware of AIDS and HIV, can make better decisions. Hopefully I encourage you all to go out and get tested. So let's get into it. HIV is a lifelong virus. It stands for Human Immunodeficiency Virus. AIDS is a medical condition and it stands for Acquired Immunodeficiency Syndrome. HIV is a lentivirus, which means it's a virus that has a long incubation period. This virus attacks the body's immune system, and it does so by specifically attacking the body's CD4 cells, also known as T cells or T helper cells. And these cells are responsible for fighting off infection. Along with weakening the body's defense mechanism against infections, it also weakens the body's defense mechanism against infection-related cancers. HIV is spread through bodily fluids such as blood, semen, pre-semen fluid, vaginal fluid, rectal fluid, as well as breast milk. There are 3 types of HIV transmission: person to person, mother to child, and contact with infected blood. HIV may be contracted through various ways. The easiest way for HIV to be contracted is through unprotected vaginal or anal sex. HIV can also be contracted through oral sex, sharing needles or syringes that has HIV infected blood, be it for shooting drugs, getting a tattoo, or getting a piercing, to name a few. You can also contract HIV by getting HIV infected blood, semen, or vaginal fluids into any cuts or sores on your body. Using contaminated surgical equipment or instruments may also be a way to contract HIV. Also, a person working in healthcare can contract HIV through any unsanitary practices or unprotected handling of HIV-infected blood or fluids. HIV consists of 3 stages. The first, acute infection; the second, clinical latency; and the third, AIDS. Stage 1, acute HIV infection. This can last anywhere between 2 to 4 weeks following the infection and is marked by flu-like symptoms, sometimes referred to as the worst flu they ever got. Some symptoms are fevers, chills, sore throat, muscle and joint aches and pains, swollen glands, and headaches. During this stage, you are at a high risk of transmitting your HIV infection. Starting treatment at this stage is very significant. Stage 2, clinical latency. This stage lasts on average 10 years or less. The word latency means that during this stage there are no symptoms or very mild symptoms that sometimes or most of the time go very unnoticed. The HIV virus continues to reproduce at low levels. During this stage, you are still able to transmit HIV to another person. Stage 3, AIDS, the most severe stage. At this stage, your immune system is severely damaged. This is indicated by either a drop of CD4 cells below 200 cells per cubic cubic millimeter of blood, or the development of one or more opportunistic infections. During this stage, you become very vulnerable to opportunistic infections. Opportunist infections can take the form of either infections or infection-related cancers that attack a person's weakened immune system. Without treatment, AIDS can last anywhere between 3 years to 1 year, depending on the presence of any dangerous opportunistic infections. Some very random facts of HIV and AIDS that you may not have known before. HIV-infected people do not have AIDS. However, a person with AIDS does have HIV. AIDS is the last stage of the HIV infection. HIV can be spread from a person who is not yet showing symptoms. The elimination of mother-to-child transmission is becoming a reality. So if you are a female with HIV, this does not mean that your child has to be born with it. Someone's positive HIV status does not indicate that they were promiscuous. AIDS does not kill people. The infections and cancers gotten by a person who has a weakened immune system does. Being a virgin does not mean you should not be tested for HIV and AIDS. Anal sex is the form of sex that is most likely to transfer HIV due to the internal trauma your body undergoes during this act. Having HIV does not mean you will infect your sex partners. The HIV virus may take up to 3 months to show up on an HIV/AIDS test. Therefore, if you do take a HIV/AIDS test within 3 months of having a new sex partner, I do recommend that you follow up after the 3-month period with another HIV/AIDS test to be 100% sure. To those who feel that they really cannot work up the courage to get an HIV or AIDS test for whatever your personal reasons are, then a good alternative to an HIV or AIDS test is to actually give blood. When you give blood, the first thing they do before they take your blood, they actually take some blood for HIV and AIDS testing, and they will contact you if your test comes up positive. So this is a way to give back as well as tackle the HIV and AIDS test. HIV is not spread via shaking hands, hugging, saliva, so that means kissing, sharing food, drinks or utensils, sharing a towel, mouth-to-mouth resuscitation, sharing dishes, toilet seats or doorknobs, through the air, so that includes coughing, sneezing or breathing, or through mosquitoes, ticks or any other insects. There are many ways to reduce your risk of HIV contraction, and if you are an HIV victim, then there are many ways that you can reduce your risk of transmission. Practicing the correct and consistent use of condoms during both vaginal as well as anal sex. Frequently testing for HIV and AIDS. Some recommendations as to when you should get tested are: at the beginning of a new relationship, you should make it a requirement that both parties get tested for HIV and AIDS. If you have multiple sex partners, this is an indication that you should frequently be testing for HIV and AIDS. Or if you're at a period where you're considering becoming sexually active, this is again another appropriate time for you to get tested for HIV and AIDS. However, the presence or company of another person should not be the reason why you get tested for HIV and AIDS. This should be something that you should want to know for yourself. Specifically for males, circumcision is another way to reduce your risk of contracting HIV virus. This reduces your risk of HIV contraction through 2 ways. 1. Your inner foreskin contains cells that the HIV virus targets to enter your body. And 2. Any small tears or ulcers that develop around your foreskin can again increase your risk of contracting HIV. Using sterile injecting equipment such as needles or syringes for drug use. Avoiding any unsanitary or questionable tattoo or piercing parlors. If you are a female with HIV and you're considering pregnancy, there are drugs to use at different points in your pregnancy, upon conception, during your pregnancy, birth, as well as breastfeeding. If you are a person with HIV, being honest with your partner is the best way to reduce any transmission to them. And lastly, the best way to reduce HIV transmission or contraction is simple: education. Educate the people that you know. Tell your children, tell your siblings, tell your friends, talk to your partner, talk to your parents, talk to everyone. Best way to reduce this HIV transmission or contraction is educating each other. Someone with HIV can take multiple steps to reduce your symptoms of the virus, as well as the rate at which you progress to the last stage of AIDS. There are medicines available to treat HIV. These are called antiretroviral therapy. If these are taken right away or as soon as you're infected and are taken every day, your life will be prolonged, healthy, and the chances of infecting others are lower. Stay healthy. To any HIV victims or AIDS victims, your health should be your #1 concern, and I do recommend you look for alternative medicines and foods. There are those out there. Food is our medicine, so do your research and see what there is out there that may help your situation. And again, I say, if you are someone with HIV or AIDS, tell people. And if you don't want to tell anyone, then tell the person that you're romantically involved with. There are actually laws in some places that require you to disclose your HIV status to your partner. So I congratulate anyone that made it to the end of this video. That shows a lot of maturity, that you understand that education is the best way to deal with this HIV and AIDS pandemic. My heart goes out to any victims of HIV and AIDS, and my condolences to anyone that has lost a loved one due to this pandemic. I do recommend, not for my benefit but the benefit of everyone, that you share this video to bring about awareness and education of AIDS and HIV. And I do believe that anything that you could do, be it sharing this video or getting tested or encouraging someone else to get tested, is a very huge step towards eliminating the AIDS and HIV. So feel free to do some more research on AIDS and HIV if you think that I haven't covered everything. I will add some more information in the description bar below pertaining to all the AIDS symptoms, because again, I didn't want to make this video very lengthy, but I will include all the symptoms of AIDS in the description bar below, and any other information that I come across that I think will be helpful to you. So in recognition for December 1st, World AIDS Day, I hope I did my part in bringing about awareness of AIDS and HIV, as well as showing my respects to those that have passed away due to this. So I hope you'll have a great week. God bless. I will see you all back in my next video. Have a good one, guys. Also, a person opportunistic.